Our first speaker today, you guys are in for a real treat. He is a bundle of energy and a great guy, is Raymond Cralle. He's a physical therapist with over 25 years experience with hyperbaric oxygen in treating so-called off-label conditions such as stroke, cerebral palsy, athletic injury, memory-related issues, concentration, and autoimmune disorders. His foundation, Hope Springs, was founded for supporting special needs individuals, both children and adults. It helps provide needed therapies such as physical therapy, hyperbaric oxygen treatment, and other forms of support for special needs children and adults. Please welcome Raymond Cralle.
Well, good morning. I'm so pleased to be here. Dr. Sears, thank you so much for inviting me to share the years of experience that we've had. My friend Neil Reardon yesterday was talking about finding friends of, it's a small world. My mentor, Dr. Leonard Smith, is here. Dr. Maharaj and I have worked together. Joe Parita, who talked yesterday about stem cells, and I have been working together since he got out of medical school, so it ages me a little bit. And Dr. Bauman is here from Boca Raton, and he certainly is aware of the benefits of hyperbaric oxygen. How many of you in the room have heard of or know about hyperbaric oxygen? Is there a show of hands? Well, great. A number of you have. We want to talk about hyperbaric oxygen and its effect on your brain and the injured brain, the aging brain, because what does all of this stuff mean if you don't know it's going on? So cognition is a major thing that we want to cover. We want to talk about the aging body and inflammation, and what has hyperbaric oxygen got to do with your brain, and what does it have to do with aging, and what does it have to do with inflammation that Dr. Maharaj was talking about yesterday? And the last thing would be inflammasomes, the new buzzword about infection and disease. So hopefully at the end of the talk, we'll have enough time to go forward.
More U.S. soldiers have killed themselves than have died on the battlefields of Iraq and Afghanistan, according to Pentagon numbers. Post-traumatic stress disorder and traumatic brain injury are the suspected culprits. Tonight, CBS 4 investigates a cutting-edge treatment that may hold the cure for the invisible wounds of war. CBS 4's Antonio Mora has the story.
I was extremely suicidal. I was a couple inches between life and death. I was drinking. I was having a lot of anxiety. I was having nightmares, severe anger issues, low rage, trying to start fights with random people.
33-year-old Barry Offenberger of Miami survived 8 months in Afghanistan. 25-year-old Jeffrey Reese of Houston spent 13 months in Iraq. Each soldier made it home whole, all limbs intact, but broken and tormented by invisible wounds.
I started having problems with PTSD and nightmares, anxiety, depression. I was on so much medication, I needed someone to help take care of me.
Jeffrey's wife left him. He had to move in with his parents.
I got angry because I gave the Army a healthy child. I got a broken child when he came back.
Barry was in a troop carrier when it rolled over. He was thrown and hit his head.
They never diagnosed me with any head trauma.
But when he returned to Miami, Barry began to change.
I was no longer happy, even though I had a ton of things to be happy for.
That's because Barry's fiancée, Erica, had just moved in with him, and she was pregnant.
It was blinds shut, no light in the house. I don't want to get out of bed. Very bitter and angry with life. It was rough.
Did you live in fear?
I did. I'd be lying if I say I didn't.
While Barry spiraled into a dark hole, Erica put aside her fears and found the determination to get him help.
I'm a fighter, and I love him.
And she found help in another hole of sorts.
And I said, hyper what? Okay.
A hyperbaric chamber is a pressurized enclosure where a patient spends time inhaling 100% oxygen. For decades, hyperbarics have been used to treat decompression sickness and severe wounds, including burns.
The presence of oxygen is how things grow and how we heal.
Ray Cralle, a physical therapist in Delray Beach, says the chambers dramatically increase oxygen in tissue, causing your body to release your own stem cells, accelerating healing. Cralle is convinced it can also heal brain trauma. off an undiagnosed problem.
Something horrible is happening because of these explosive devices that are not being looked at.
A focused brain injury, such as an elbow to the head in a basketball game, as seen in this ESPN video, can be detected with common diagnostic scans. But Cralle says only a nuclear SPECT scan can detect a collection of little air bubbles in the brain that are caused by repeated exposure to concussive blasts.
On paper, a record 46 IEDs impacted on my vehicle. An RPG came right over my truck and impacted the wall that was probably about 5 feet away from me.
The veterans have, their brains almost look like popcorn because they've been hit in so many areas.
This is Reese's brain imaging before his 40 hyperbaric treatments. And this is his brain image after treatment. Smooth and round like a normal brain, says Cralle.
We flew him back 9 months later to be sure that we didn't have some short-term effect, and we retested him psychologically. He even did better.
I went from not being able to find my house to making the dean's list every semester since then.
He's back. And that's what it took, I do believe.
As for Barry Offenberger,
I don't think I'd be here. Either dead or in jail.
instead, Barry and Erica are watching their 2-year-old Isabella grow up.
I hope it just gives someone, at least one person, a little bit of hope that there is help.
So far, Cralle has treated 14 veterans for free. The Red Cross has also helped pay for other expenses because insurance doesn't cover hyperbarics for brain trauma. That is largely because no substantial scientific studies have been finalized. The Pentagon has begun an 18-month extensive study of this treatment on brain injuries. It will conclude this summer. Antonio Mora, CBS 4 News, tonight.
So even if they're found effective, it'll take years before they can roll them out to treat the troops.
But those veterans say they did not think that they would last very long.
That's right.
So Jeffrey Ruiz, it's been 11 years, and he graduated with honors in marine sciences. None of the over 40 vets now that we've treated pro bono have had another depressed day. They've gotten off all their medications, and so I've had the opportunity to present this in Tallahassee. In the state of Oklahoma, they passed a law that all veterans have access to hyperbarics because it is the cure for concussive injury. This next video, I think, speaks to this issue. It's about a brigadier general who was a sitting judge from Florida, and he was in the Army Reserves, and I'll let the video speak for itself.
Well, good afternoon. Good afternoon. My name's Pat Maney. I'm just another broken soldier. And I want to thank the Navy League for sponsoring this event. This is a huge step forward for those of us who have experienced traumatic brain injury. I was a general, a reserve general. He was mobilized and deployed to Afghanistan. I was there for 17 months. I got blown up, as they said. My bell was rung on August 21st, 2005. I spent almost the next 20 months at Walter Reed Army Medical Center. You know, under the Army regulations, you can only be broken for a year, and then they kick you out. So I had been there about a year when a friend of mine suggested I try hyperbaric oxygen. Now, when I tell you I'm broken, let me take just a moment to kind of describe that. I was awake. I could walk. I could talk with some hesitation. But I basically looked okay. The problem, of course, is the brain is inside the head and not outside. Maybe it's a good thing, but that's the way we're built. And my wife literally led me around everywhere I went. I couldn't remember how to go places, what I was supposed to do when I got there. I couldn't carry on conversations. There were these long, pregnant pauses while I tried to find words. One time she took me, always leading me, to the commissary. And you know how you get to the end of the aisle and turn and go down another aisle? She turned and I didn't see her turn. And I was lost. I literally literally stood there because I couldn't figure out how to solve that problem and go somewhere else. One time I was at the Bethesda Naval Hospital gas station, pulled up, got out of the car, opened the gas cap, put the nozzle in, and had no idea how to pump gas from a self-service pump. I was in uniform, so you can imagine the surprise of the lady on the other side of the pump when I asked her how to turn on the gas pump. But that's what a brain injury does. You can look all right. You can kind of function. You can walk and talk, maybe. But you're not there. And hyperbaric oxygen has totally turned that around for me. A doctor friend suggested that I receive treatment at George Washington Medical Center here in Washington. And, you know, what Admiral Fanning didn't say is in civilian life, I have a job as a judge. I'm an elected judge. And I knew that I was not only losing my Army career, but I was going to lose my civilian career because I couldn't function. So hyperbaric allowed me to go back to work. And I because of my personal experience, I saw and was able to recognize litigants and defendants who came before me who had traumatic brain injury. And I started looking into our jail population. Over 10% of the county jail in the county where I live are veterans. And I noticed that many of those had traumatic brain injury from, not just from this war. We had one that had been shot in the head in Panama. And of course, at the time of the Noriega, the time we removed Noriega in Panama in 1989, there wasn't a diagnosis for traumatic brain injury. I say that only because we've got many people in our society with traumatic brain injury. Many soldiers, even from this war, who are not diagnosed. And it just seems to me very important for all of us to try to join this coalition for hyperbaric oxygen. When I had hyperbaric, it's cumulative, you know. You don't notice any difference after any one treatment. Yeah, you get up and you leave. But the cumulative effect is amazing. After about 8 dives, 8 treatments, my wife thought she noticed I was getting better, but she didn't say anything because she wanted me to get better and she was afraid she was seeing something because she wanted it, not because it was real. After about 12 dives, I started thinking I was getting better, but I didn't say anything because I didn't want to raise my wife's hope. After about 20 dives, people who knew me before the injury and people who knew me after the injury started saying, "You look better. You're more engaged. You're talking in sentences and paragraphs." And that was a major difference. I've always been a reader. I couldn't read a paragraph and know what the first sentence was by the time I got to the last sentence. I couldn't balance a checkbook. I could write a check, but I had no idea what the numbers were, how to do simple subtraction. I couldn't concentrate long enough to watch a television show, so I would channel surf all the time. Drove my wife crazy. I couldn't sleep, so I was up at 2 or 3 in the morning. That also drove my wife crazy. So I guess part of that story is hyperbaric oxygen made my wife's life much better. And I think it's important, and I think some of the people here on this panel will tell you that a lot of these situations have 2 sides. The patient's side with its frustrations and the caregiver's side with its frustrations. And when hyperbaric oxygen does its magic,